Hello everyone, welcome to our Transformation Journey, a webinar for leaders to launch our digital and equipment transformation. I will moderate today's event, which should run for about 30 minutes, after which we'll have some time for Q&A. We have several presenters today, and leading off will be Rob McIsaac, our President and CEO. We also have Dr. Wes Steven, EVP Clinical Operations and COO, Dave McKeag, EVP Corporate Affairs and CFO, and Dr. Michael Stacey, EVP Academic and Chief Medical Executive. For those of you who are new to webinars, there are a few bits of housekeeping we need to get off the bat. So we are recording this presentation, and everyone will get a link to it following the event. If you're able, please use your mobile device to listen to the webinar, as this will reduce overload on our internal phone system. During the presentation, your phone lines will be muted. Just a reminder again, please dial in. You can see the number on your screen here if you haven't already done so. That is the only way you can hear the audio of this event. During the Q&A portion, you can ask questions either via the Skype chat box on the bottom left of your screen, or you can pose your question over the phone. Instructions will be provided closer to the end of the presentation. And finally, please call the help desk at extension 43000 for any technical support. And with that, I now hand it over to Rob.
Thanks very much, James, and thanks everybody for attending today. I know we had a bit of a glitch the last time, so thanks for hanging in and coming back, and I think all of us appreciated the irony associated with that. Just to get started, I think from my perspective, a lot of work has been done over the last 5 years, laying the foundations for big changes in terms of how we operate. I'm super grateful to everyone for all of the difficult work that has been done over this time, and I know that work continues because of the restraints that are placed on us by the province and a host of other reasons. So thank you for all that you continue to do to help make HHS a great place. Today we want to speak with you about the next phase of the journey that we are on. I think it's likely plain to many of you why we are doing all of this, but to summarize very quickly, the world is changing rapidly, and we need to respond to and even get ahead of the changes that are occurring if we want to continue to serve our patients and our community well. An aging population, changing expectations of the people that we're serving, rapid advances in technology are all driving us to fundamentally change the way that we operate. I think business as usual will not be sustainable. Demands for our services are increasing, and they're increasing in a way that is beyond the resources that we are being provided to respond to them. So in lots of ways, it feels like we're trying to respond to bigger demands while equipped with a very old set of tools. We're still keeping paper records, we're still sending faxes when a growing segment of our community is quickly getting used to virtual services and instantaneous access to information. We're also dealing with a brand new legislative regime which is requiring a fundamentally different approach to delivering health services to our community. I think we can be proud of where we stand in this regard. We're leading the province in many respects in this endeavor. We were successful in the first step of the Ontario Health Team process, and we're one of the early consortiums chosen to proceed with a full proposal. Our full proposal went to the ministry earlier this month, thanks to a lot of hard work by not only the team here at Hamilton Health Sciences, but a team of people from across the community, across the sector. As much as Ontario Health Teams could well result in a new way of HHS relating to our community, they are also going to, or this health team will also drive change within the hospital. I think we can be proud of the work we did over the last 5 years in developing our HHS strategy. In many ways, our strategy was prescient in terms of the changes we've come to face. Our work in population health and strategic partnerships has proven foundational to our current environment. When the call for OHT proposals was made by the current government, we were well ahead of the vast majority of the province in terms of our thinking and in terms of having developed relationships with key partners in the community. So in many regards, I feel like we've already begun to transform HHS. Our strategic direction of operational excellence, which is very much embodied in our CQI program, is well underway. We've got dozens and dozens, almost 100 units now trained up in CQI. It may feel difficult to imagine, but during the next 3 to 5 years, the pace and intensity of our transformation work is going to increase. I'll pass it over to Wes Stephen.
Thanks, Rob. Transformation is really about unlocking our people's talents with tools, technology, culture, and systems that support our mission to provide the best care for all. All our efforts need to be aligned to this mission, and it really is about creating value that enhances the patient and family experience. Over the next few minutes, you're going to hear high-level details about 5 enablers that supports us through this transformation: Ontario Health Teams, continuous quality improvement, our managed equipment service agreement, a strategic performance collaboration, and a digital health plan are all important enablers for us to achieve our mission. It really is about translating our strategic plan into concrete actions and maximizing the 13,000 problem solvers across our organization. I'm going to turn over to Dr. Stacey to continue the presentation.
Thanks, Wes. Excuse me. We've made some great quality improvements across the organisation in the last few years, and now we're building on our culture of empowerment to keep improving the CQI work. You can see from this slide the extent of that work and how far it goes into the organisation. This next slide gives us an outlook of what's ahead. We want to better connect our strategy with the improvement work at the front line. We also want to ensure that the CQI process is efficient amongst management levels as it is with our frontline people. As an example, we want to go beyond the regulatory aspects of quality to fully align the quality program with our strategy, and in particular, our enterprise approach and operational excellence. I'll hand back to Rob.
As mentioned earlier, Hamilton's proposal was submitted earlier this month for the Hamilton Health Team. HHS, as our region's largest leading healthcare provider, was central to this process, and I think will be central to the Hamilton Health Team going forward. There's still lots that's unknown in this regard, just because of the way that the province has structured the call for proposals. But I think it's fair to say we're really committed to this initiative, and we're excited about what it could mean for our community. This is a powerful opportunity to advance our population health agenda and to do so with strategic partners. Our Ontario Health Team application is focused on creating new solutions for many of the people who use our services most frequently. We're relying on lessons learned from our work in projects like HealthLinks and scaling up that approach so that we can serve vastly more people using it. I'll pass it over to Dave McKeag.
Hi all. I wanted to talk a little bit about the digital health plan. I think I think everyone understands, and even in our home lives, it's very difficult to keep up with technology. There is always a new flat screen or something that can do things a little bit better. But Hamilton Health Sciences, we know we're not where we want to be in leveraging technology for the better care of our patients, but also for the experience of our staff and physicians. This is not a new thought. We've been working on this plan for some time. In fact, the inaugural Digital Health Plan was 2017 was when we put this onto paper, and have been spending a lot of time articulating the goals, lining up financing, et cetera, so we can make these investments. So where are we at on some of that work? Really very excited on how some of this is coming together. And at the end of it, it's around being able to make sure that the information that staff need and physicians need to make decisions is in their hands when and how they need it. I'm hoping that at the end of our journey, we're going to be able to say something like, I finally feel it was easy to get or even have pushed to me just when I needed it, the information I needed to deliver better care. So there are several project streams that are underneath all of that, but again, and you'll hear terminology like UDA, which is around making sure that we can capture and store our information the way we need it and access it how we need it without needing to call a department and log a request. So some very exciting opportunities there, and that's going to lead us to things like real-time decision-making information, longer-term capacity planning for the organization, and resource allocation decisions such as financial planning and analysis. We're going to build a solid data continuum that puts all of that together and in the hands of our decision makers.
So the issue for us is the recognition that our DI fleet is certainly in many ways is before its best before date. Recognizing this, the managed equipment service agreement is really about a new model of procuring and maintaining and using diagnostic equipment. A component of that is a partnership with a private sector vendor to help us implement changes within the organization. We would see the MES as an improvement for our patients by improving patient flow, and more efficient use of updated machinery and DI would lead to a better experience and better quality of care. We would see potentially less wait times for our patients with a more efficient and modern fleet of DI equipment. From the user's point of view, not to worrying about maintaining the equipment when it's past its best before date and having more up-to-date tools is an enhanced benefit to the providers. And from an organization point of view, standardized equipment across our HH sites leads to predictable, stable cost and budgets and less costly maintenance. With respect to the strategic performance collaboration, which is a component of the MES, we are looking for an innovative partner to help us unlock some of the transformation that will be helpful with the deployment of the new equipment. We see it from the staff and physicians and leaders, a sophisticated process to maximize workflow and skills. Patients would have a better integration of their experience across our enterprise. And from an organizational point of view, standard processes with potential financial savings. A key factor of success is really an efficient coordination of all this transformation. Under Rob's guidance, a transformation committee, executive committee has been struck and is in its early days, where transformation initiatives are examined in a broader context of improving how we must improve to serve our patients better. It really is about alignment and gating, understanding conflict between competing projects, and monitoring timelines and resource requirements of the whole enterprise. I'll turn it back over to Dave.
So what does this mean for the immediate next steps? Really doing a lot of work to lay the foundation so that we can start to see all of these benefits. I think the state of some of our equipment and our systems, we really took the only decision that we could, recognizing it comes with challenges, but we're moving ahead on many fronts at once. I don't think I've ever heard anyone in healthcare suggest that it didn't feel busy. It's going to feel busy, but focused on transformation and setting the stage for what HHS can be in the future. You can see on the slide many things already underway. 4,500 new computers being installed across HHS is a really welcome thing for some of the old equipment. I already mentioned the OHT submission to the ministry. The MES and the SPC contract is likely going to be signed by the end of the calendar year. Again, an extremely exciting initiative and partnership. So I think what the point of all of this is the transformation work will increase, and we are committed to supporting you as leaders and equipping you with the tools to help work through all of this change. And we are very, very ready to listen to challenges, questions, and things that we need to consider as we move forward on all of this transformational work. Pass it over to Rob.
We're also committed to supporting you in communicating all of this out to your teams. Our communications surrounding our transformation will be broken down into what we hope are easily consumable chunks with a consistent focus on how is this helping our patients, staff, and the organization. Internal messaging will focus on improving the workplace experience, bringing innovation to keep pace with changing healthcare needs, and making the most of skills of people at Hamilton Health Sciences. So that's a very high-level overview of some of the big projects that are currently underway and which I think will soon start to actually impact on you and your teams in the relatively near future. We're happy to take questions based on what we've presented to you this morning.
Great. Yeah, that's all great stuff. So let's open up the floor to questions here. So again, you can ask via Skype in the bottom left corner. So on your screen here, you've got a little pin pointer here that shows what to do there, and our operator, Roxanne, will also go through how you can do it over the phone. So Roxanne, let's open it up.
Yes, thank you. Please press *1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience.
I think in terms of what we're already doing in this space with CQI and the digital health plan, we're already underway with a lot of the stuff. So I think it's really exciting to see everything come together now in a full transformation journey. So let's hear what everyone else has to think.
Once again, please press *1 on your telephone keypad if you have a question. There are no questions registered at this time. I'd like to turn the meeting over back to Mr. Scarfone.
Rob, is there anything from our peers in this region or perhaps globally that are doing similar work in this area that we can perhaps highlight?
I don't. Every hospital is of course unique, and Hamilton Health Sciences has an array of unique challenges, legacy challenges that I think lots of this will overcome. So I don't think anybody's doing exactly what we're doing, but there's no doubt lots of people are moving ahead with new HIS projects for their hospitals. I do think that, particularly as a leading academic health sciences center here in Ontario, if we don't press ahead with a new HIS, we will be left behind by other hospitals. In terms of some of the other things, though, the MES, maybe a couple of hospitals have done this already in Ontario. Not a ton. I would say we're probably in the vanguard. The Strategic Performance Collaborative, I think we may well be the first to do what we're doing in Ontario, although certainly across the continent in North America, other North American hospitals have entered into similar relationships. In terms of the data and analytics, I think we will be very much in the vanguard in terms of having a data an ability to manipulate data in a way that will allow us to make really smart decisions and understand the impact of decisions before we make them. So I guess the short answer is yes, some people are doing some of these things, but I don't think anyone else is doing all of these things.
We have a question from Lauren here on Skype. How can we hear more about the progress of the Ontario Health teams, and will this be discussed in subsequent webinars or newsletters?
Yeah, so I would say broadly, all of these things will be the subject of frequent communications as we move forward. We do intend to make sure that we're equipping our leaders with collateral that will help them to communicate these things out in a way that is consistent across the whole of the enterprise. So I do think it's important that people are hearing the same message about what's happening, irrespective of where they happen to be located. With respect to the Ontario Health teams in particular, it's a very dynamic file, and so to some extent we're kind of at the mercy of the province because they're the principal decision maker in terms of approvals and structure moving forward. So we will communicate things about the OHT out as we learn them, and hopefully consistent with the balance of the projects we've talked about this morning, so that you're not reading things in the newspaper ideally before we get them to you. We'll certainly do our best.
Another question here through Skype from Sarah. How are we planning to incorporate the patient voice into our transformation journey? I don't know if we want to give that to Rob or...
Yeah. we certainly are committed to a new way of doing business that incorporates feedback and not just feedback, but collaboration with our patients. And so you can see that in a variety of ways. We've got patient advisor groups across the whole of the enterprise helping us with things. And so we'll definitely take advantage of our patient advisors as we move forward and make decisions around many of these projects. Some of the projects, like a Unified Data Architecture project, probably isn't quite as amenable or ideal for the voice of patients as some of the other projects, like I think the HIS ultimately will be quite amenable to having the voice of patients. I guess I'd just hasten to add, on the Ontario Health teams, Hamilton Health Sciences pushed for patient advisors to be co-chairs of that initiative, and so we had a patient advisor from Hamilton Health Sciences, Mr. John Fleming, and St. Joe's also put forward a patient advisor, both of whom have been very competent chairs of that initiative and have made sure that the patient's voice has remained a constant throughout the project. So I don't know if any of my colleagues wanted to add anything. Dave?
Yeah, I think we'll see a lot of the patient voice and the staff voice and the physician voice come to play in a lot of the implementation. You can certainly picture that in enabling digital technology, how information flows. Are we talking about, within our four walls only, or are we talking about permeable walls where patients can schedule themselves or see their information or communicate with their physician, or the physician colleagues could communicate easier with each other? I think there'll be a lot of that we'll see in the implementation stages and certain aspects of each project, and I think it's always going to be top of mind for all of us that those stakeholders are very well considered, because we want to get this right. This is an incredible opportunity and an incredible time of transformation. We want to get it right for all of those stakeholder groups.
We're getting several questions through Skype. I'll take another from Skype before I go over to the phone to see if we have any coming through there. But Bruno is asking, do we have any more timelines or details for the HIS renewal? So Dave, I think you might be able to cover that one.
Sure. There's a lot of work going on right now trying to examine the two existing platforms that we have within our organization. You would know them as Meditech and Epic, and looking at what the opportunities might be and what path we want to go. So there's been a huge effort around, do we want to upgrade to the brand new and very robust Meditech platform, or go down a procurement pathway? And that work is underway now. We have not made that decision. We have what's called the Clinical Steering Advisory Committee. I think I finally got that right, Mark. No, I did not. He's shaking it strategic. See, I knew I would get it wrong. That group is working towards making that kind of a recommendation that we'll be able to take in consideration. An implementation of a project like that is minimum 18 months. So we're talking about 18 to 30 months before we would be turning on a brand new system, depending what pathway we go.
Do we have any questions over the phone?
We have no questions registered at this time. As a reminder, please press star 1 on your telephone keypad if you have a question.
In the meantime, we'll go back to Skype here. So Michelle is asking, what can I tell my staff at a high level what this will mean for their roles? Wes, do you want to?
Yeah. So I think most of us would agree that the organization, we're a bit stuck given the state of our tools and our systems and our data. What we really see with this transformation is really unlocking the talents of our people and actually allowing them to do value-add work. I think one of our challenges is it's a bit frustrating for people that they're doing work that quite honestly could be better done with a better tool or a better system. And whether you're providing direct care or support care, without good data, we're struggling with good decision making, we're struggling in providing great care, not that we don't, but to be in the future. So what it really means is there will be changes on the way people are doing their current job. We are hopeful of taking back some inefficient time, as an example, from nursing and redeploying it into actual care in the front line. It is really about allowing people to do value-add work and remove some of the waste that we have because of poor technology or poor systems. So at a very high level, we would say that the status quo is not ideal and that people's work hopefully will be enhanced by providing these tools and the systems and the data to allow people to perform at a higher level. Recognizing that people do a great job. It's not a comment about what people are currently doing. It is really about the future and the needs, meeting the needs of our patients and their families.
So Karen asks, as these initiatives continue to unfold in addition to staff communication, how will this information be shared with patients and families so we can support their understanding of these changes?
I'm going to ask Aaron Levo, who is our Vice President of Public Affairs, we've had our communications folks highly involved in every aspect of the planning and delivery of these. So Aaron and his team have been doing a great job. I'll just ask Aaron to talk a little bit about his vision for how we're going to make sure people are well aware of what's going on.
Thanks, Rob. I think the question specifically about our patients and our publics, from my point of view, it starts inside. Like, we are going to launch, as of today, on the Hub, a series of resources for everyone working at Hamilton Health Sciences, our staff, physicians, to access, to begin to have the conversations that are needed internally. I would also say that the things that we're talking about, these are big projects with a very long duration to them. As Dave pointed out earlier, the implementation of an HIS system is something that we'd be looking at doing 18 months from now. That doesn't mean the work starts in 18 months. It means now we start having these conversations, we get prepared, we think about change management. There's a lot that's going to be happening inside Hamilton Health Sciences, and as we do that, we will see opportunities to then speak to our public. I think there's going to be questions asked of all of us as this work progresses. There's a lot happening. We'll be heading up into an infectious season very soon, and capacity is stretched thin. We're going to be talking about the transformative work that we're doing to ensure our operations are sustainable in the face of all of that, and as well over the next 5 years. So I think in making those responses to the public, we'll have opportunities to talk about this work. We'll be equipping our leaders with the tools to do so with the people you work directly with. And then as an organization, you'll have some certainty, as Rob said at the outset, as to what we're talking about when we are responding to questions from the public. And as specific projects move forward, I was glad to hear the question about patient involvement, not just in an advisory capacity. I think that's a wonderful way for people to be involved in the work now. As we roll things out, we are going to look for very innovative ways to keep the patients and families we serve apprised of what's changing in our organization and what they might expect different from us. So some of this we have we have well-tested and we have great tools to do that. In some areas we'll be looking for innovative ideas from those of you working at the front line to help us do that even better. So it's a big answer to say there's some things we're doing right now today. There's some stuff that'll happen over the next, the coming 6 to 8 months. And we'll be looking for feedback, too, on how to do that even better.
Another question from Dr. Andrea Frolick here. So she has a question about the newly launched People Plan and just asking if there will be any modifications or enhancements to that plan that will support staff, physicians, leaders, and learners through this transformational process. Dave, do you want to...
Absolutely. Yeah, so the People Plan has started, and, we've launched it, I believe, in May, have made some great progress and some early uptake on the areas that we chose to focus on initially. Will there be changes? Absolutely. It will evolve to understand the needs of the organization, the needs of you, the needs of individual leaders. We're also looking at how we bring this all together so that we're building the workforce, the skills, the people, that we know where they're coming from and where they're going to, that people's careers are being enhanced, and that we have the workforce that we need when we need it. So a lot of work underway in those regards, and this will be an ongoing and continuous evolution. It's a plan. It's something that you have to start to move forward on and then pivot when you need to. So I think you're going to see more as we go. We did take a bit of a thoughtful pause to take a look at some of exactly that over the summer, and we're moving forward on some other exciting new work.
We've got one last question here from Barb Klassen. So she's asking about the diagnostic imaging development. Is there a plan to ensure that diagnostic are in line with future needs? In other words, the increase in demand for interventional radiology as best practice.
So I'll take that one on. I think that there's been a fair bit to answer the question. We believe yes. There has been a fair bit of work done by the team. It was a very collaborative process of external experts coming to work with our team, had a process of engagement of all the providers, the physicians, to look at our current inventory and to predict the future inventory. And we actually have a templated list of, I'm going to misquote it, but 400 some odd pieces of equipment in DI, and the timelines of when they need to be swapped out and when we think the future needs will be. However, we are in healthcare, and we need to recognize that new technologies come along in a very short order, and some of our older technologies may need to be sunsetted. So it was thought purposefully in the process, but to be honest, it's not an exact science. But to answer your question, yes, there has been forethought about the future needs of the community.
Thank you, Wes. And thank you for those questions. Rob, did you want to talk about leadership?
Yeah, maybe just to conclude, on November 6th, we're having the Leadership Summit. So I would really encourage as many folks as possible to attend that. As leaders at HHS, the easiest thing in the world is to sort of get caught up in firefighting. I totally get it. It happens to me lots. But this will be a day that will give all of us an opportunity to kind of step back and think broadly about the future of Hamilton Health Sciences and how we can shape that future. I think it's going to be a really interesting day and valuable for everybody who attends. So November 6th, please keep it in mind and hope to see you there. Maybe just to end, I'd say our transformation has one big goal, and that's ensuring that HHS continues to be a leader among Canadian hospitals in providing safe, high-quality care. I think harnessing technology and the skills of our people by giving them the most modern tools will allow people to spend more time at the bedside and help us really to ultimately fulfill our mission and vision of best care for all. So thanks very much, everybody, for attending today, and hope to see you on November 6th at the Leadership Summit. Thanks very much.
It's some great information to unpack, and we're looking forward to keeping everyone informed of the latest developments about our transformation journey, both on the Hub and through our regular newsletter. So that concludes our webinar today. Thank you to our speakers and to all of you on the webinar for joining us. You should expect the recording and other relevant information to come your way in the coming days. Have a great afternoon, and please don't forget to vote today.